Hi guys, and welcome to Chapter 9 on joints. This PowerPoint is over 100 slides long, so I'm just going to tell you guys what to study and what I want you to focus on, because I know you have enough going on studying the skeletal system, but we do want to get through joints because they're an important part of the skeletal system. Joints are the rigid elements of the skeleton where bones will meet together at joints, also called articulations. The Greek root arthro means joint. Structures of joints are structured in the way to enable resistance to crushing, tearing, and other forces. You should know that joints can be classified by function or structure, and you should know these functional classifications of joints. A synarthrosis is an immovable joint. So this is common in the axial skeleton. For example, your skull bones joined together at the sutures are synarthrosy joints because they are completely immovable. Amphiarthrosis means it's slightly movable, and a diarthrosis means it's freely movable. So a diarthrosis is all your elbow, your arm, your hip joints, freely movable. So you should know the functional classifications of those joints. And then the structural classification is based on the material that binds the bones together, the presence or absence of a joint cavity, and other structural classifications that can be fibrous, cartilaginous, or synovial. So here's a look at an example of fibrous, cartilaginous, and synovial joints. The structural characteristics of the joints, whether they're bound together by collagenous fibers, cartilage, or synovial joints, meaning there's a cavity with synovial fluid inside. Here are the different types of fibrous joints, cartilaginous joints, and synovial joints, and then how mobile they are. So fibrous joints are immobile, so they're called synarthrosy joints. Some might be slightly mobile, amphiarthroses, and then the synovial joints are the freely mobile, the diarthroses. So if you don't study anything else, but just study these first 5 slides, that will be good. I might include some other things, so keep listening. Fibrous joints are bones that are connected by fibrous connective tissue, no joint cavity. Most are immovable, maybe slightly movable. These are the types of fibrous joints. We can have sutures, which hold the bones of the skull together. Syndesmoses, which are bones connected exclusively by ligaments, such as different joints. The interosseous membrane is a type of a syndesmosis, which is between the radius and ulna, and that is a freely movable diarthrosis. Gomphoses refer to teeth in their socket, and these are the different types of fibrous joints: a suture, syndesmosis, or gomphosis. So knowing these types of fibrous joints. Cartilaginous joints lack a joint cavity. They're bones that are united by cartilage. They can be synchondroses or symphyses. Synchondroses are hyaline cartilage uniting bones, like the joint between your first rib and the manubrium, other in the epiphyseal plate. So this is the synchondrosis fibrous joint. Fibrocartilage unites bones and resists tension. So the fibrocartilage are found in intervertebral discs and pubic symphysis. They're slightly movable, and hyaline cartilage is present as articular cartilage. So here are examples of symphyses, fibrocartilage, and the pubic symphysis as a cartilaginous joint. So they're made of cartilage. Then synovial joints are the most movable. They're diarthroses. They each contain a fluid-filled joint cavity. And this is the general structure of a synovial joint. There's articular cartilage that covers the ends of the opposing bones that help absorb compression. And then the joint cavity is unique to these synovial joints. The cavity is a potential space that holds a small amount of synovial fluid. The articular capsule is the joint cavity enclosed by 2 layers, the fibrous layer and the synovial layer. And then the synovial fluid, it kind of looks like a raw egg white. It filters blood and it contains glycoprotein. There's what we call weeping lubrication, where pressure on the joints will squeeze synovial fluid into and out of the articular cartilage. Then we have ligaments that reinforce. Sometimes they're often thickened parts of the fibrous layers. Sometimes they're outside of the capsule or inside the capsule, and these will help to reinforce that synovial joint. It's richly supplied with sensory nerves to detect pain, and most to monitor how much the capsule is being stretched. There's a rich blood supply to synovial joints. Most supply the synovial membrane, and there's an extensive capillary bed. So here's a look at the general structure of a synovial joint. And this would be found in your elbow, in your knee. You can see the articular capsule layers, the articular cartilage, then the joint cavity filled with synovial fluid, and the joint itself will often be reinforced with ligaments. Synovial joints with articular discs, some contain an articular disc. It occurs in the temporomandibular joint and at the knee joint, and it occurs in joints whose articulating bones have somewhat different shapes. Synovial joints act as a lubricating device to reduce friction. Synovial joints are subjected to compressive forces, so the fluid is squeezed out as the opposing cartilages touch each other, and the cartilages will ride on this slippery film to reduce friction. Bursa and tendon sheaths are associated with synovial joints. Bursa are flattened fibrous sacs. Then tendon sheaths are an elongated bursa that wraps around a tendon. They also help to reduce friction between the body elements, and they're like closed bags of this lubricant. So here's looking at where bursa and tendon sheaths are located on the right shoulder joint. Movements allowed by synovial joints, they can glide, angular movements, and rotation because they're very freely moving. Gliding joints then, gliding occurs between your carpals, your wrist, the articular processes of your vertebrae, and your tarsals or your ankles. And these are flat surfaces of two bones sliding past each other. So here's our look at gliding movements. Angular movements include flexion, extension, abduction and adduction, and circumduction. And you should know what these mean. These will increase or decrease the angle between bones. Flexion is bending or decreasing the angle, and extension is straightening or increasing the angle. We can have flexion and extension of the whole body trunk. Flexion is bending, decreasing the angle. Extension is straightening back up. Flexion, extension of the knee. Flexion is decreasing the angle, and extending is straightening it back out. And we can do the same thing with our arms, extending the arms, straightening them back out, versus flexing the arms, decreasing the angle. Then we get to abduction and adduction. Abduction has the word abduct, so it's taking things away from the midline. And adduction is adding body parts back to the midline. Circumduction is a rotational movement using both. Here are movements of the pectoral girdle and a great animation that describes those. Rotation involves any turning movement of a bone around its longitudinal axis. In the vertebrae, the only movement allowed is between the atlas and axis to do the rotation of the head, shaking it no, but rotation also occurs at your hip and shoulder. And here are examples of rotation throughout the body. Lateral rotation is moving a structure away from the midline, and medial rotation is rotating it back inward. Elevation and depression. Elevation, lifting a body part superiorly. Depression, moving the elevated part inferiorly. You can do that with your mandible, with your scapulas. Protraction and retraction. Protraction, anterior movement. Retraction, posterior movement. And that can also happen with the mandible. Protraction, protruding out. Retraction, pulling it back. Supination and pronation are forearm movements. Supination are where the palms face anteriorly, so your palms face forward or up. And pronation is when the forearm rotates medially and the palms face posteriorly. Opposition is your thumb moving across the palm to touch the tips of your fingers. And oftentimes, I have a lot of experience with this because my daughter broke her arm. The doctors will see if they can do that, because that will tell them if the ulna and radius are working well. So that's opposition, touching your thumb to all other fingers. So here's a look at pronation and rotation, pronation and supination, and then opposition. Inversion and eversion. Inversion, turning your soles medially. Eversion, turning them laterally. Looking at a picture showing those examples. And then dorsi and plantar flexion. Dorsiflexion is lifting the toes so the superior surface approaches the shin, and plantar flexion is depressing the foot and elevating the heel. A good way that I remember this is dorsiflexion is moving your toes to your nose, so kind of straightening your foot. Plantar flexion is kind of planting your foot down as if you're taking a step. So dorsiflexion, toes to the nose, and plantar flexion, planting the foot down as if you're taking a big, heavy step. The plane joints, so then we'll get into some synovial joints classified by shape. Plane joints have short gliding movements. I won't ask you a lot about plane joints, but they're found in the metatarsals and carpals. Hinge joints, I might ask you, a good example of a hinge joint is the elbow. And this is angular movement in one plane. So this is an elbow, a hinge joint. Pivot joints, examples of this are your radio-ulnar and atlantoaxial joint, rotating bones along a long axis. I won't ask you really about pivot joints. Condylar joints, I won't ask you too much about, but you can see where you'll find a condylar joint in the body. Saddle joints, sliding back and forth, left to right. We might find some saddle joints. And then synovial joints, I will ask you, these are the ball and socket joints where the spherical head of one bone fits into the round socket. They're called multi-axial because they allow for multiple movements. Here are the movements of the glenohumeral joint, which is a ball and socket joint. Articular surfaces are shapes. Shapes of articular surfaces will determine the movements that the joints can play. Ligaments will help to reinforce, prevent excessive motion. They help to stabilize the joints. And then muscle tone also helps to stabilize joints by keeping tensions on the tendons. So muscle tone, it is important to work out your muscles to help stabilize your joints better, because as your muscles get stronger, they will help to stabilize your shoulder, your knee joints, as well as supporting the joints and the arches of the foot. The temporomandibular joint is the joint between the mandible and the temporal bone, and that is shown here. You can see how ligaments reinforce that joint. The sternoclavicular joint is a saddle joint. I'm going to cross over some of this. You guys don't need to know a lot of these details. The shoulder glenohumeral joint, it's a freely movable joint, so it lacks stability. Usually as joints are more movable, they're less stable. And here's a look at the shoulder joint and the different ligaments that contribute to its stability. The rotator cuff is made up of these four muscles and their associated tendons. I want you guys to know these four muscles that make up the rotator cuff, but you don't need to know anything else because the shoulder joint is so unstable. It's a common injury spot for common shoulder injuries, whether you're a pitcher, a spiker in volleyball, any other time that you might have a lot of movement with your shoulder, your rotator cuff muscles might be the ones that get injured. And this is a look at the shoulder joint. All right. Elbow joint is a type of synovial joint. It allows for flexion and extension. It's a type of a synovial joint and it's a hinge joint. So there is your elbow joint. And the big one that I want us to focus on, so I'm going to skip over a lot of these. The hip joint, I want you to know, is a ball and socket joint, how the head of the femur articulates with the acetabulum. Here's the hip joint movements. But the big one I want us to focus on, and I want you to spend time studying, is the knee joint. It's the largest and most complex joint. You probably know people who've had injuries with their knee joint. So I want you to learn well the knee joint and the structures and the tendons and ligaments that make up the knee joint. Specifically, this is a look at a superior view. You can see the anterior cruciate ligament and the posterior cruciate ligament. You can see here the meniscus, which are body parts that help the tibia and femur from sliding past each other. The ACL and PCL are often parts that get torn, as well as the posterior and lateral ligaments. So here's a good view of pictures that I want you guys to know well. Here's the lateral or the fibular collateral ligament, and then the medial or tibial collateral ligament, often abbreviated LCL or MCL. You can see here the patella, the tendon of the quadriceps muscles, the patellar ligament. So you should know well the ligaments of the knee joint. And in the back, we have the anterior popliteal ligament, the tibial. What I really want you to know is the cruciate ligaments form an X, and the cruciate ligaments are your ACL and your PCL. So here are cruciate ligaments, the ACL and the PCL, and they form an X on the inside of the knee. And those are often sometimes sites of tears. So knowing the ACL, PCL, how they make the X on the inside of the knee, and the fibular collateral ligament, LCL, and the tibial collateral ligament, MCL. You should know those four ligaments. And these slides describe a little bit more about those ligaments and what they prevent. And you can see how these ligaments bend when your knee bends. All right, the ankle joint, I'm also going to skip over Disorders of joints. Structures of joints make them very prone to traumatic stress. The function of joints makes them subject to friction and wear. They're affected by inflammatory and degenerative processes. Torn cartilage is a common injury to the meniscus of the knee joint. A sprain is whenever ligaments are stretched or torn, and a dislocation is when the bones of a joint are forced out of alignment. A bursitis, so whenever we see a word itis, that means inflammation. Bursitis is inflammation of a bursa due to injury or friction. Tendinitis is inflammation of a tendon. And tenosynovitis is inflammation of the tendon sheath. Arthritis can describe more than 100 kinds of joint damaging diseases. Osteoarthritis is the most common type of wear and tear. Rheumatoid arthritis is a chronic inflammatory disorder. Gouty arthritis is gout, but that's when uric acid builds up and causes a lot of pain. And Lyme disease is an inflammatory disease, often resulting in joint pain. The joints throughout life, I'm going to kind of skip over this. This is how your joints will grow and change. One big thing to know is that exercise does help maintain joint health. And that's it for this chapter on joints. And this takes us to the end of module 2. I hope you guys are still doing well and with me. Wish you guys all the best on your next lecture and lab exam.